Good morning. Today we're going to be talking about berry aneurysms and the fact that there's now hope for berry aneurysms here in Nigeria. Thank you, Dr. Ninalowo, for coming on the program. It's always a pleasure to have you with us.
Thank you for having me again, Dr. Pamela. It's nice to be here.
Now we're talking about, you are really revolutionizing medicine here in Nigeria with your interventional radiology. What is berry aneurysm? Why are we so concerned about it?
Yeah, so berry aneurysms are essentially abnormal swellings of vessels in the brain. So most vessels in the brain are kind of straight, and then they branch into branch vessels, which get smaller. When you have a berry aneurysm at some of these branch points, you have an abnormal swelling of one of these vessels, and they become prone to bleeding or prone to rupture. And when we say rupture in medicine, it basically means it's burst open and causes a lot of bleeding into the brain.
And so, what are the symptoms? What are the signs? Or should we start with the causes? What causes these aneurysms in the brain that can really go pop?
Yeah, so interestingly, no one really knows what causes berry aneurysms, but we do know that they tend to run in some families. So if a family member has had a berry aneurysm, there's a higher likelihood that another family member would have a berry aneurysm, but we still don't know exactly what causes it. We do have some theories in medicine. High blood pressure, for example, is the causative factors that we've talked about, but we still don't really know what the etiology is. They're really random. As far as the symptoms of berry aneurysms, interestingly, most of the people with berry aneurysms don't know that there's anything wrong with them until something, and it's typically the worst headache of your life. Essentially, a person basically comes in and says, I have the worst headache I have ever had in my life, or they just go unconscious. We do a CT scan of the brain, and at that time, we discover there's been bleeding in the brain. And then we have to do further testing. Typically, we do something called a CT angiogram of the brain, which is a test where we inject dye into the small vessels in the brain to see the vessels in the brain. And at that time, we could find a berry aneurysm and make a diagnosis.
Now that is, that's obviously very alarming. So you could just be walking around happy as Larry and just all of a sudden have an excruciating headache and you could collapse and potentially die. Is that what you're saying?
Yes, unfortunately, most of the people that do come in with berry aneurysms basically have their lives changed in a flash. You have somebody who's had a normal life as pretty much healthy, may have high blood pressure, and the next day you see them in a comatose state in an ICU because they've had a major bleed in the brain. As you know, the brain or the head, the intracranial vault, is a very compact space, and the brain occupies most of that space. When you have blood occupying any space within the cranial vault, that basically causes compression on the brainstem. I'm sorry, not on the brainstem, the brain itself, or causes irritation of blood vessels in the brain, and that could basically drive a person into a coma pretty fast.
What is the outcome? What is the, of people with berry aneurysms? How has it been so far? Is there, usually treatment available for people with it?
Yes, absolutely. There is treatment in Nigeria for people with berry aneurysms, and that's typically conventional surgery, where a surgeon basically makes a small hole in the head, goes to find the berry aneurysm and puts a clip in it. Unfortunately, all over the world, the world is much more advanced than major surgery, major brain surgery when it comes to berry aneurysm. We've now moved on to endovascular techniques. And moreover, there are some berry aneurysms that are not amenable to surgical techniques, meaning some of them, they just cannot approach technically via surgery. So those patients are basically confined to death if they don't get a treatment for it, or they can't travel out. And you have to think about it. A lot of these patients are moribund, or they're in a very bad state. So you can't get them out of the country to get treatment anyways. So as I said, all over the world now, the new treatment for endovascular, for berry aneurysms is basically endovascular techniques, which are minimally invasive techniques that do not, go ahead.
No, I wanted you to explain it, which you're doing. Thank you.
Yes.
What are endovascular techniques?
So basically, endovascular techniques, meaning you're not really cutting a person's head open to get into vessels in the brain. or clipped vessels in the brain, you're using minimally invasive access. And it could be a minimally invasive access through the wrist or the groin with a very tiny catheter the size of a pen tip. And then you find your way with a catheter and a wire all the way from that groin site all the way into the brain using x-rays. And these are typically biplane x-rays where you're looking from the top and you're looking from the side to find a way to navigate into those vessels in the brain. When you do locate the aneurysms, then you place something called coils. And these coils basically pack the sac of that aneurysm and stop blood from going in there and causes the aneurysm sac to thrombose or clot off. And with that, most patients that have Berry aneurysms could have treatment without having major surgery. And remember, these patients are already in a poor state. When you want to treat a patient in a poor state, you really want to use the most minimally invasive method possible. And these are things that are done routinely everywhere else in the world, especially in the Western world now. Unfortunately, we still don't have that readily available in Nigeria.
But you are doing it. Can you tell us what you're doing? And this whole project, I know you're doing a brand new project to try and help people with Berry aneurysms. Can you tell us about it?
Yeah, certainly. So my field of medicine is called vascular and interventional radiology, and in vascular and interventional radiology, we have two sides. So we have body interventional radiology, and then we have neuro interventional radiology. So I'm a body interventional radiologist, meaning I treat most things from the neck to the toes, while my colleagues in neuro intervention treat things in the brain. I had a passion to basically find a way to provide all interventional radiology techniques that are available in the Western world in Nigeria about 4 or 5 years ago when I started practicing here. And we've been able to accomplish that in body interventional radiology, which is my major area of specialty. However, in neurointerventional radiology, which is even more specialized, we've not been able to accomplish that. We actually started that effort right before COVID, where we treated our first patient with a Berry aneurysm in Nigeria, and we successfully treated a patient, I think, who's coming on to this program this evening. However, in order to accomplish that, I had to bring one of my colleagues from England to come assist me in getting this done for this patient. And the plan was to, carry on that program to get me trained and be able to do this independently in Nigeria. But the COVID pandemic basically just stalled that process. We just revived that about 3 weeks ago, where we worked up about 3 patients within a month. Unfortunately, 2 of them died before any of my colleagues could get here from out of the country. But one of them survived enough for us to be able to do Berry aneurysm treatment for that patient. And we want to continue that effort in the next few weeks. We want to keep that momentum going. So we're looking for those colleagues to come into the country about every 2 months now to do a mission trip to even treat patients who cannot afford it. And we're doing this with the help of our foundation, the Kolawole Interventional Radiology Foundation, which is basically dedicated to treating emergent conditions in patients who are best treated by interventional radiology.
Thank you. I mean, that's really a laudable, program, and having this foundation. I'm going to ask you for its number in a minute, because a lot of people, have, insurance. They feel they can fly abroad for their medical treatment. But a lot of people don't realize that, what? There are many conditions, including this one, but there's nothing you can do. If you can't get the treatment here and now in Nigeria, then really you're a goner. So having this foundation, particularly, to be able to provide for people who can't afford it, is wonderful. Can you give us a number? So if people are listening and they're thinking, what, I would like to support this, they can perhaps call you. Can you give us a number they can reach you on?
Yeah, absolutely. You can reach us on 0902-741-6551, 0902-741-6551. You could also reach us at info@irdocnigeria.org.
irdocnigeria.org. Yes?
IRDOC Nigeria, the word Nigeria.org.
Okay, perfect. So at least they can reach out. I think it's so important that these kind of conditions are looked at and aggressively treated. So how many people do you think you'll be able to sort out with this? Because I know that so many people have died. I don't know if we have any statistics on the mortality of Berry aneurysms, even abroad, available for our people.
I'll tell you, just in the last month alone, I know at least 4 patients that have died with Berry aneurysms, just in Lagos. And because I run a teleradiology company where we read teleradiology for a lot of hospitals, across Nigeria, we're seeing so many patients with berry aneurysms. This is one of those diseases people didn't think was in Nigeria because people would just basically fall and die, right? Now that we have all these techniques to actually diagnose, because a lot of technology has come into the country in the last few years, CT scans, MRIs, we could actually make the diagnosis, but we're still crippled in being able to treat these patients, right? So we're making small progress, but we still can get to where we need to be able to save lives.
Mr. Uche, thank you so much for coming on the program to share your experience with us. Can you tell us? Yes, thank you. Can you tell us, how did you find out you had a berry aneurysm?
I found out after it happened to me, like Dr. Nino rightly said. I had come back from a vacation where I thought I'd gone to rest. Midnight, 4th of October, I had this very bad headache at the back of my head that ended up continuously as a pulsating headache. I was rushed to the hospital the next day and had an MRI and a CAT scan. That's when it was discovered I had an aneurysm in the hospital. And this was in 2019.
Wow. And did you have high blood pressure? What were the things that you think could
yes,
be causing it?
There was. I had I'm hypertensive. I was on some medications, but of course, naturally, like most Nigerians, you're either not at a younger age, you're either not very consistent with your medication, you're not checking your blood pressure regularly, you're not living the right lifestyle in terms of diet, exercising, and all of those. So you could categorize me as one of those set of people.
And how old were you at the time?
And yeah, that's what happened.
And how old were you at the time?
3 years ago, I was 44 years.
Okay. And then you were rushed into hospital, and thankfully you were able to meet up with Dr. Ninalowo. It's a sort of I don't know what the statistics would be for a person in Nigeria being that blessed. So what happened?
Sorry, I lost you. There was the network was a bit unstable. I didn't quite hear.
I said, I don't know what the statistics are. Almost like a 1 in a million chance for you meeting up with Dr. Ninalowo. You're very blessed to have been able to do so. So can you tell us from what you can recall what happened? And after that, if you can't recall much, then I'll ask him.
As much as I could recall, I knew himself and the team of doctors had to come together to carry out a possible, what they call non-invasive surgery. To keep me honest in the terms, I don't know it quite right. And at first cardiology, I was moved in for a surgery on the 19th. Was prepared for the surgery, and I came out just like most people. The first thought around me was touch the back of my skull to see if there were any incisions or any cuts or any shaving. Even though they had promised me it was going to be through my groin, but then again, the human factor, I needed to check to be sure. There were no cuts on my head, no bruises, and apart from a slight irritation on my groin. The rest is history. 3 years down the line, I'm still alive here to share my story with people to say there is an opportunity in terms of the non-invasive surgery that Ninalowo and his team of doctors provide for us.
And what advice would you give to people out there?
The same advice I've given myself. If you've been identified as being hypertensive, try to keep a good lifestyle, watch your blood pressure regularly, take your medication, see your doctors regularly also, and just believe God. Because I have lost a friend post my surgery, not one, I've lost 2 friends post my surgery to the same condition. Unfortunately, they were unable to access the non-invasive surgery that Dr. Ninalowo is speaking to, and had to go through the clipping process, which most of them died post-care.
Oh, well, we thank God for you. We thank God for your life. Dr. Ninalowo, thank you so much for the wonderful work you're doing in Nigeria, bringing all these revolutionary techniques and technologies here for our patients. And I think this is one of the things that at the Healthcare Federation of Nigeria, we really encourage with you doctors in the diaspora coming back and bringing those techniques home. And we want to appreciate you on behalf of all Nigerians. And I'm sure on behalf of Dr. Uche, Mr. Uche here, to say thank you very much for being here. And we certainly don't want you to go anywhere. So Dr. Ninalowo, what would you say? Would you say there's an age preponderance? Would you say it's more normally people in their 40s, 50s? Would you say there's a male or female preponderance? What kind of things, as people are listening now, but possibly they're worried? You know,
so interestingly,
who
it
is
does
more
look
likely
like
to
there's
get
a
it?
female preponderance to berry aneurysms, and most people present typically in their 30s or 40s with a subarachnoid hemorrhage. But again, there's really no way to know who is going to present with one of these. So we don't have any standard screening test, right? So when you have a disease where there's no screening available, the only thing that we do have available is making sure that we have a good treatment for it when it happens. As Mr. Uche said, he's lost 2 friends to berry aneurysms in the last 2 years or so, right? And you find that very sad. Both patients did have access to surgery, which was conventional surgery, opening up their brain to go clip those aneurysms. But you have to understand that a patient who's had a major insult in the brain already is in a very bad state already, right? That patient going to surgery has a very high risk of something bad happening after surgery. So we do have to make sure that we're using the least invasive techniques possible to treat these patients.
Yeah, thank you so much. I think that's really critical. And with the large amount of people with hypertension, people are going to be wondering, is there anything they can do to prevent it from happening?
Yeah, I mean, we all know that high blood pressure is actually one of the most endemic diseases in Nigeria, and a lot of people actually do not adhere to their medication regimen or lifestyle regimen prescribed by physicians. And as I tell my patients, I mean, not taking your blood pressure medications or not monitoring your blood pressure regularly is probably the fastest way you could kill yourself, right? So you cannot screen for berry aneurysms, but what you can screen for are diseases like high blood pressure, where you could monitor it appropriately and take your medications appropriately to make sure that you're within range. Typically, we advise that the blood pressure, when your blood pressure medications, your blood pressure should be measured about 140/90. And even if you could get it better, it should be better. So the basic thing is, adhere to your medications and listen to your physician.
Thank you. And when you are speaking about that, there is another common complication of high blood pressure, which is stroke. And I think when I was speaking to you in the break, you were saying there are some techniques you can do to improve stroke, because a lot of times when people have a stroke, the outcome is usually quite poor. Can you tell us how this interventional procedures you can do can improve stroke as well?
Yeah, absolutely. So we have 2 types of stroke. So we have hemorrhagic stroke, which is what we're talking about, like berry aneurysms or any types of bleeding in the brain. And we also have something called ischemic stroke. Ischemic stroke meaning one of the vessels in the brain is basically blocked and blood cannot get to the brain normally, which is why we say someone's had a stroke, they can't move their hand or they can't speak normally, they have slurred speech. So all over the world now, we now have advanced techniques to treat stroke, to treat patients with stroke. Meaning you go to a hospital with stroke, they don't just look at you. They basically go in with a small catheter in your groin again or your wrist, go find a blood vessel with the clotted blood vessel within the brain, and they could actually remove that. And that is basically night and day. You've turned a person who is basically going to become a vegetable or become completely dependent on their family members to a person who could walk out of the hospital 2 to 3 days later. We do not have that technique available in Nigeria today. If the new president of Nigeria gets a stroke today, it will be basically moribund because we don't have that technique available in Nigeria today, right? So it doesn't matter how much money you have, how much access you have to the international world. When it comes to the brain, time is brain. If you do not have that technique readily available to you, and a country with 200 million people, we definitely need that technique readily available. If you don't have it readily available, you're going to do as poor as the next poor man on the street because there's no difference. The brain does not differentiate who you are. It's going to die.
Now, that's actually something I must say I want to say congratulations to our new president, the inauguration having taken place. We are hoping that health will be a focus. We need a lot of focus on healthcare, and particularly for the Healthcare Federation and the private sector. You know, we're looking forward to very positive policies that will enable us to grow and to enable us to obviously work with our colleagues in the diaspora, like people like yourself, encouraging them to come back home and bring these techniques home to us. Now, with the case of Mr. Uche, is there anything specific or special? How was it that he was able to make it and live? And his, you know, you've talked about the other issues, but how was it that he was so fortunate and got you? And how can others make themselves fortunate and have access to you?
So, you know, you're correct. He was very fortunate. And it's all about, in Nigeria, time, place, and chance, right? So he got admitted to a hospital that had access to my services. And they knew what was possible. And they consulted us and it said, we have a patient with a Berry aneurysm. It's not doing too good. We really don't want to take him to surgery because he might have a poor outcome from surgery. What could you do? And I said, well, I don't do neuro interventions, but I have a colleague who's willing to come from London in a very short period of time to get this done. And, you know, Mr. Uche's family, I mean, I could say they love him very much because they were very motivated into getting this done very quickly. I mean, I remember there were like 7 people in the family hovering around the hospital at all times, you know, talking to me and calling. And we were able to get my colleague in very fast, Dr. Kunle Ogungbemi in London. And, you know, we got the cerebral aneurysm done against all odds. We had a high five. As I said, we thought we were going to continue this momentum, and then COVID came. But what have we done recently? What we've done recently is we actually expanded our team. Now we have 2 neurointerventional radiologists on our team. One in Dubai, who came in 2 weeks ago to do the case with me, and Dr. Kunle Ogungbemi in London, so coming in for the mission that we have scheduled in June. And between these 2 guys and myself, we're going to try to cover as much time as possible in Nigeria, meaning a person has a Berry aneurysm. In 5 to 7 days, we want to get somebody down here to treat them. And the patient also has a lot to do because with Berry aneurysms, how we're going to do it depends on how you do in those first 5 to 7 days. And you have to do this, unfortunately, and God has to be a part of that also, meaning you have to survive enough for us to offer you treatment so that the Berry aneurysm doesn't then bleed again. So that's also very important. So the care of these patients is not just about also treating the Berry aneurysms, it also goes much further than that. We've also now collaborated with a neuro-intensive care doctor, Dr. Benjamin Anyanwu at Regents Hospital in Owerri, who's now put together a team for us so that when we have a patient with a Berry aneurysm, we have neuro ICU experts helping us take care of this patient. So it's really teamwork. So we have the ICU team at First Cardiology Consultants, we have Regions Neuroscience helping us, and then we have the 3 of us interventional radiologists coming together to form this team called the Neurointervention Team for Nigeria right now.
That is fantastic. And you have a special on right now. We just have a couple of minutes left. Can you just sort of tell us how people can contact and how people get to be a part of this? If they know somebody who has a Berry aneurysm right now, what can they do?
Yeah, absolutely. If you know someone who has a Berry aneurysm, even patients who have basically no resources, we're committed to making sure that we improve skills in the country and also take care of these patients because we know this is between life and death. And you could contact us again at 0902-741-6551 or email at info@irdocnigeria.org. Again, we're still looking for support from a lot of our corporate partners. We're still really rallying to get support because we can't do this by ourselves, but there's definitely hope in the future. I hope by the end of next year, we should be able to do this independently in Nigeria, readily at 24-hour notice or less.
Okay, that would be really fantastic. Thank you very much for sharing. And thank you, Mr. Uche, for sharing your experience with us. We do appreciate the work that you're doing, Dr. Ninalowo, and wish you all the best.
Thank you for watching. Please like, share, and subscribe for new video updates.